If you like your health care plan, you will be able to keep your health care plan, period. If you like your doctor, you will be able to keep your doctor, period.
Turns out that wasn't true. Can't necessarily keep your doctor or your plan. How about your medication? Can you keep that? Maybe not. There's a former Medicare policy advisor in the Kelly file with this warning.
The list of drugs that the plans cover in many cases aren't very long, and if the drugs aren't covered, then you're on your own. You basically have to pay for it entirely out of pocket, and the money that you spend on those drugs doesn't count against your out-of-pocket limits, and it won't count against your deductible. This could cost patients with special conditions, patients who need special drugs, a lot of money, literally tens of thousands of dollars a year.
Wow, that from last night. Byron York Today, chief political correspondent, Washington Examiner, and a Fox News contributor. Byron, hello to you.
Good morning, Bill.
Let's go through the facts first. Is what he is saying true?
Yeah, it is. I mean, first we heard a lot about higher premiums under Obamacare, then higher deductibles, and then narrower doctor networks. Now we're hearing about prescription drugs. And the deal is, Obamacare sets up a situation in which the health plans create what are called formularies, which are the lists of drugs that they will cover. And the law specifies that they have to cover at least one drug in zillions of categories. The federal list of approved drugs is, as you imagine, quite long. But it doesn't cover all the drugs in any particular category. And what could happen is millions of people could be on medication right now that's not covered in the formulary of the plan that they choose. And it gets really bureaucratic at this point. If you are on a drug that's not covered, you have the option of appealing to the Centers for Medicare and Medicaid Services. That could take months. And if you lose the appeal, you have to pay for the whole thing out of your own pocket.
Wow, that last part, just continue that. If the drug is not on the list, you pay out of pocket.
That's absolutely right. And Scott Gottlieb, the expert we just heard, is correct. It will not apply to your deductible. We already know people are facing deductibles of $500, $7,500, $12,000. They're facing huge deductibles. And so this could be a real surprise for a lot of people. And here's something else that's very important. You listen to this and you think, well, gee, I need to find out whether the drugs I need are covered under the health plan before I choose one. Well, most of the formularies are not listed on the websites that people are shopping for coverage.
Why would that be?
Well, it just hasn't happened yet. The websites really are not fully together, as you know. It's been a huge news story for a couple of months now. Yeah. And they're complete lists that people can go by are not available or are very difficult to find on a lot of healthcare websites.
Byron, did we know this, or did we know this was coming? Did we know that this was baked into the law?
You know, this all goes back to that famous Nancy Pelosi quote where you have to pass the bill to find out what's in it. You actually have to implement the bill to find out what's in it. Some of this is in the law. Some of this is in the regulations that were written by the Obama administration after the law was signed into law in March 2010. But it's something that nobody really confronts and knows about until it begins to happen in their lives.
Why would you craft something like that? What would be the means to the end to have that language?
It's to save money, and it's a way for Obamacare to pay for some of the mandated benefits that people didn't used to have, like mental health care coverage, that were not in a lot of policies but are now mandated by the federal government to be in the policy. So they have to save money somewhere, and restricting these prescription drugs is one of the ways they plan to do it.
So you have to skimp in some areas, right? I mean, that's the premise that you're describing there. Right. Is that the same premise for the doctor or doctors that you may or may not have access to?
Oh yeah, I mean we've seen a lot, certainly in Medicaid, and you know Obamacare depends a lot on Medicaid expansion. They are actually cutting the money paid to doctors who see patients under Medicaid, so much that we've seen one report in the Washington Examiner that 70% of the doctors in California aren't going to take Medicaid patients. So you'll have a large number of new patients and fewer doctors to see them. That's what is going to happen here.
So Byron, tick through this. If you like your plan, you keep your plan. Maybe not. You like your doctor, keep your doctor.
No.
Maybe not. Like your medicine, medicine works for you. Maybe you keep it, but you pay for it out of pocket. That goes back to what Dr. Ezekiel Manuel said on Sunday morning with Chris Wallace. Yeah, you can keep your own doctor, he finally conceded, but you'll have to pay for it.
I think that was one of the most revealing moments we've had in this whole Obamacare thing, where Chris Wallace was pressing Zeke Emanuel on this issue, and Emanuel first said the president really didn't promised that you could have any doctor you wanted, and finally said, look, if you want your doctor, you can pay for it. Now, that is true anywhere in the world. In the National Health Service in Britain, if you want your doctor and you've got enough money, you can have it. But most people can't do
AKA
that.
cash. Now, Byron,
Exactly.
what do you think the effect of this is on voters, on everyday Americans, once they continue to peel back the layers?
You know, I don't think we've seen the full political effect of Obamacare at all, because we've seen what's happened in the individual markets. We've seen that roiling and controversy that's taken place there. We haven't seen what's really happening in the small group market, which should be happening in the next 6 months to a year. We haven't seen what's happening with when the subsidies start flowing on January 1st, and we haven't seen what's happening in this prescription drug thing. So there are lots of things that could affect the political system both ways, some perhaps pro-Obamacare, many anti-Obamacare, that really haven't happened yet. Hard to predict.